We are extremely grateful to be given this opportunity to share what South Africa did to support COVID-19. I'd like to apologize on behalf of the Minister of Higher Education, Science and Innovation, Dr. Blade Nzimande, who could not join you today because of other pressing government issues. But I'd also like to start by making a couple of acknowledgements. Mr. Wang Zigang, Minister of Science and Technology from China, Mr. Chen Jining, Mayor of the People's Government of Beijing Municipality, Professor Hou Jianguo, Vice President of the Chinese Academy of Sciences. So I'd like to start by sharing with you the health research that we did in support together as a Department of Science and Innovation with several partners that we work with in the science and technology innovation system. These partners include entities that have agreed on a research agenda, and it focuses on a number of areas that I'm going to share with you now. First, we have been involved in the testing where we have used both the PCR, polymerase chain reaction, and the point of care serology surveillance. We've also been doing surveillance in communities and in hospitals, especially working with patients that have HIV and TB history. We have participated in therapeutics, immunological studies into natural history, vaccines, convalescent sera studies, monoclonal antibodies, molecular epidemiological studies, data modeling, as well as international partnerships. I will go through some of these research activities in detail. Firstly, South Africa's dependence on reagents that are sourced from international companies was unsustainable because of increasing global demand, fluctuating exchange rates, and limited transport options that affected the supply. And this resulted in an urgent need to source these components locally. The department and its partners and entities, such as the South African Medical Research Council, SAMRC, and the Technology Innovation Agency, TIA, put out a call for locally manufactured reagents, and in July 2020, 7 funding awards to local companies, organizations, and researchers were awarded in order to ramp up the country's ability to produce locally developed reagents and test kits for COVID-19. The call and awards focused on the development of diagnostic reagents and the development of rapid detection kits. The companies and organizations that received the awards are either supported by ourselves as a department or are supported by one of our entities. The example of the recipients of the awards include the Council for Scientific and Industrial Research, CSIR, which received a grant that expedited the local manufacture of viral nucleic acid isolation kits for nasal and oropharyngeal swab samples. The CSIR worked closely with a number of spin-off companies on this project. And one of such companies is the Cape Biotechnologies, a company that we have supported as a department, which also received a grant for the development of application-ready rapid testing PCR reagents for COVID-19. Also, the development of rapid test kits focuses on the rapid detection of the presence of SARS-CoV-2 viral proteins and/or particles and excludes antibody tests. The advantage of rapid detection offers a number of advantages over the usual PCR diagnostic methods, as these tests can be administered on the spot and the results can be read within as little as 15 minutes. Here too, we supported smaller companies that we were already doing work with. Because, like the rest of the world, South Africa did not have sufficient ventilators to treat those infected with COVID-19, our President Cyril Ramaphosa established the South African National Ventilator Project to tackle this challenge. The Department of Science and Innovation, together with the Department of Trade and Industry and Competition, implemented the project. The system design and oversight was done by the South African Radio Astronomy Organization, SARAO, an organization that belongs to one of the entities of the department, and SARAO acted as project managers given their world-class systems integration and systems engineering capabilities. On the 29th of July, the locally manufactured set of ventilators were unveiled, showing the components of the device, which is the blending unit, and the device supplies a pressurized mixture of ambient air and industrial oxygen to the patient through a mask or a hood. The ventilator project has a close-up blending device, and the pressurized gas helps the patient by supplying a higher level of oxygen and by keeping the airway and lung pressure elevated above the surrounding air pressure throughout the breathing cycle. And this ensures that the patient's lungs operate effectively. We've also been supporting other entities such as the KwaZulu-Natal Research and Innovation Sequencing Platform, popularly known as CRISP, which is located at the University of KwaZulu-Natal in KZN. CRISP is supported by the department through its entity, the Technology Innovation Agency. CRISP trained over 1,000 of health care workers, producing genomic protocols, and capacitated dozens of laboratories in Africa to respond to COVID-19 pandemic. CRISP began the whole genome sequencing of the virus to track how and when it was introduced into the country. This data has helped to understand how the virus arrived in South Africa, inform policy early on government's response to COVID-19. To date, CRISP has sequenced over 1,000 genomes. The DNA sequencing to map the viral evolution has assisted in the diagnostics, vaccine, and therapy development. CRISP was recently invited by the World Health Organization and the Africa Center for Disease Control in July this year to join the Genomics Surveillance Network and in the Network for Genomic Surveillance in South Africa. And this has provided a platform for key collaborations between the 5 National Health Laboratory Services virology labs around the country and the neighboring academic institutes and their bioinformatics teams. We've also invested on data tracking for COVID-19 at the data center, which is located at the CSIR. This data center set up to monitor and track the spread of the coronavirus in the country. The center, which is housed in a secure facility at the CSIR, provides close to real-time analytics and dashboards on the outbreak per province, district, local municipality, and ward. As part of the national data-driven approach to countering COVID-19, the CSIR has developed a platform that monitors human mobility to better understand movement patterns across specific areas such as virus hotspots and high-risk and vulnerable areas, as well as to monitor lockdown compliance and the spread of the virus. A particularly useful capability is the mobile visualization platform, which is called the CIMO app, which is used by community health workers to record screening data and symptoms and transmit information to the center. It enables near live display of the household screening and testing program. The data and insights generated by the center are a significant input for decision-making by the National Corona Command Council, which is chaired by the President. We've also invested in the South African Center for Epidemiological Modeling and Analysis, SACIMA, which is a national research center dedicated to doing modeling and analysis to improve health in South Africa and across the continent. SACIMA has been engaging with sources of data and modeling groups, refining their assumptions with a view to produce an updated model of the spread of the epidemic over time. President Ramaphosa, as chair of the African Union, participated in the COVID-19 Global Pledging event, which was hosted by the European Commission. President Ramaphosa committed South Africa to support global science effort to respond to COVID-19, especially in vaccine development. And as a first step, the South African government committed to investing 25 million rands in the BioVac vaccine manufacturing capacity to ensure that Africa has appropriate capabilities for COVID-19 vaccine manufacturing. South Africa is also participating and co-funding with European partners several COVID-19 projects as part of the European Developing Country Clinical Trial Program that is funded by the EU. So in conclusion, we have successfully looked at the investment that as a department we have made and how we have repurposed it to support fight against COVID. And these investments go back to 2001 and 2006. Secondly, the capabilities that we have demonstrated as the Science, Technology and Innovation System demonstrate how we can assist in the reindustrialization opportunities, support international partnerships, and provide solidarity in the execution of COVID-19. Thank you very much.